first speaker, Dr. Shaista Malik, was not able to make it tonight. Yeah. And Dr. Malik was actually my inspiration for starting LEOCADIA. And the reason for that is she was definitely a doctor with a great bedside manner. And she's a doctor that actually listens. So when I said that, you know, I have this indigestion, do you think it could be heart disease? I don't know that there's too many doctors that would have paid attention to that. And she really did. And she kept asking about it and asking about it. And it ended up being heart disease. So it's really a shame that she couldn't make it tonight. But another doctor that helped me an awful lot is Dr. Jenab. And even after I was diagnosed and on some medication, I had incredible fatigue. And I just didn't know what to do. And he was able to help me. And so I'd like to introduce Dr. Arvin Jenab, and hopefully he can explain what he did.
Thank you. My name is Dr. Arvin Jenab. I'm really glad to see you all here. I've been with Sue when she first started to talk about creating this organization, this nonprofit, and I was happy to be able to be there and support her as a board member, founding board member. At that time, I didn't realize what I was getting myself into, so that's the truth. I was a busybody looking for more things to do. And so when Sue approached me, it seemed the right thing to do, and I'll explain a little bit about why it seemed so right to do. So Sue was my patient for a few months. I've been working at the center with Dr. Malik for a couple of years now. And when I met Sue, she'd already been diagnosed, and Dr. Malik and I had a chance to speak about her case, get to know more of the circumstances that led to her health deteriorating, everything from her history until her current situation. And in meeting with her and talking to her, the passion Sue had for her health and the interest she had in getting to know what she was going through, what she was experiencing as a cardiovascular patient now, was really remarkable. And in fact, when she asked me to join the board, I recalled, actually when I was preparing for this tonight, I recalled or was reminded of one of my instructors, our professors in medical school, and I'll tell you a really quick side story, and then I'll come back and make this more formal. So I had a professor who was a big inspiration to me, and this professor really tried to teach me a lot of wisdom, maybe not just me, but I felt like he was speaking to me every time he spoke. Excuse me, one of the important things that he always used to tell me was, do something that you're passionate about, do it really well, and do it now. And that always stuck with me. It was really important, I thought, words for me to really grasp. More than grasping, I think I clenched onto it a little too tightly, so I was like determined. It didn't help that I just finished reading Fountainhead by Ayn Rand, if anyone knows. So I was out there ready to take charge of my destiny and do what was really important for me. But life had a different plan and a different path for me. So what I learned quickly was that his wisdom was important, but the lesson that he was trying to teach me was really something that you earn over years. And so the many years that followed, I started to learn that you can't clench or grasp at something that you're passionate or passionate for. You need to really just become more aware of what it is you're passionate for so that you can be more mindful of it when you see it, so that you can recognize it. And so I went through life, I did a lot of things I was passionate about, but I didn't do them well. I did a lot of things well that I wasn't passionate about, and I also did a lot of things that I wasn't passionate about, and I didn't do them well, and I don't think I ever finished them. So now, after 20 years, I've realized that it's really important to recognize those opportunities and those moments as quickly as you can and just become a part of it. And when Sue approached me, which is where the story is going, I felt that. I felt like this was the right thing to do. I didn't know a lot about cardiovascular, microvascular disease, or coronary microvascular disease. It was something I learned about in school, something I came across in literature, but really it wasn't the content of this that really drove me to join. It was Sue and her passion and her confidence in doing this and achieving this. So thank you, Sue, for reminding me of that doctor at that stage. So I've learned a lot in the last year. When I joined the board, like I said, it was less than a year ago. And Sue works really fast. She gets things done. She's very productive. I often thought we should hire her. But she makes it look effortless, and I think that's a sign of passion and perseverance. She makes it look effortless. She supports us all. And in doing that, she supported me in learning important lessons about cardiovascular disease, especially in women, and especially in this case with coronary microvascular disease. So in this process, I've done my research. I've read all of Dr. Merz's papers, which I think are outstanding and really groundbreaking when it comes to cardiovascular disease, and you'll hear from her later today. And what I learned is that there's a lot of important information that, as a naturopathic doctor, I can gain from that literature and the research that she's done. It's not really focused on medical. There's so much information in there about risk factors that pertain to patients' lifestyle, their diet, their nutrient status. And that was important, and that really sort of started to shed some light on what my role can be in patients who have coronary microvascular disease. There's really 2 points I think I'll try and make. I had a lot more points, just as a side note. I had a whole PowerPoint prepared for you guys. But then I was reminded this morning that there is no PowerPoint presentation here. And it's not a medical conference, it's not a lecture to medical students. It's a gala, but it's been a while since I went to a gala. So here I am. So the 2 points that I really will stick to. One of them is that prevention is key, and this is not a new point, so I know you've heard this before. All cardiovascular disease, in fact, a lot of different conditions can be prevented. There are risk factors with coronary microvascular disease that are reversible risk factors. They're preventable, which means that if we can identify what those risk factors are early on, we can start to take steps to support those patients that are at high risk. Some of these risk factors include things like vitamin D deficiency, estrogen deficiency, stress, and inappropriate stress response. These are all things that are measurable. So in addition to healthy diet, healthy exercise, healthy mind, we can actually be extremely targeted with what we do for patients who are at risk of this disease. We can measure it, we can correct it, and we can hopefully measure outcomes, or at least someone like Dr. Merz will measure the outcomes, and find out if correcting risk factors, in addition to all the treatments and interventions that we have available, has better outcomes for patients. And as someone who's trained more as an integrative doctor, as a naturopathic doctor, my job is to look at how the body functions as a whole. So when I see literature that shows risk factor for cardiovascular disease is increased in patients who have diabetes, patients who experience a lot of stress, patients who experience or have hypertension, high cholesterol, inappropriate hormone balance, inappropriate stress response, that really rings, that really is significant for me, because I look at that and say, well, the whole person needs to be treated. This isn't just a disease, but these are so many elements of this patient's care or health that need support in order for us to be effective at treating this one disease. So that's one point. And the second point is that in addition to prevention, which is great for people who haven't yet been diagnosed, but not so great for people who have been diagnosed. In those cases, we might be able to prevent progression of the disease and mitigate some of the risks and symptoms. But really, once you have a diagnosis, what are our options? What can we do in addition to some of the interventions that exist currently that can really curb the outcomes for the better? So I started to delve into some of the treatments based on some of the hypotheses that we've come to learn about this disease. So what we know about the disease is that it's a constriction of blood vessels. It's not a blockage, and that's key, and I think you'll hear more about that. And so if it's a constriction, then there are elements that contribute to constriction, narrowing of the blood vessel, rather than elements that contribute to blockage. So I started to look more into the literature and started to find more information that was really interesting. One was the role that the nervous system plays in this. So what the study started to demonstrate is that patients who've got an elevated or a very active sympathetic nervous system or rather they have decreased parasympathetic activity, which means that their baseline tends to be more in a stress state rather than a relaxed state. That those patients experience more symptoms and have worse or poorer outcomes. And that's important because that's, again, something that we can change. We can measure a patient's autonomic nervous activity, which is how much are they in stress versus a relaxed state. We can measure that with things like heart rate variability, hormones, and then once we measure it, we can then introduce elements in their treatment that can start to modulate or change those factors in favor of better health and better cardiovascular health. Example of treatments that would do that is meditation, yoga, biofeedback, which we know can really help to affect heart rate variability and hence parasympathetic activity. We can do that with herbs and nutrients and supplements. We can do that with lifestyle changes. We can do it with counseling, just changing people's perspective on things, how they react or respond to different stressors, just to help them be a little bit more relaxed. And I think most of us would agree, a little more relaxed isn't so bad. It's easy, it's welcome by most patients, they just don't know how to get there. And that's our job, is to really help them get there. The second really interesting concept that I came across when I was looking at, actually this is something I've known about, but I had never put it into the context of microvascular coronary disease, is the notion that the heart is a metabolic organ. And like any other organ or tissue in our body, the heart is subject to what we call supply and demand. It requires oxygen, that's the supply, so the supply of oxygen has to meet the demand. It's basic economics. So when the blood is constricted and the heart can't get blood or oxygen, there's a deficit. And so now there's not enough supply to meet the demand. So what we've done for many years when we looked at coronary artery disease is we focused a lot of our treatments on how to remove blockages, how to increase supply to meet the needs or the demand for the heart. Right? Am I following me? This is where it gets technical. So we're trying to increase supply. We've been trying to do this for a long time. There's lots of great ways we can do this. But what if we could decrease demand without losing function? Right? So what if we decrease demand without compromising the capacity of the heart to function any differently? This is like any good worker. You try and give them the tools to do more with less, but do it better. Right? That's really what we're saying. We want the heart to do more with less and do it better. And to do that, we sort of start to go down what's called metabolic cardiology. The idea that the heart as a metabolic organ has the capacity to function at a higher capacity with less. And so if we can do that, maybe we don't need to focus only on increasing blood supply by opening up the blood vessels, but we can just decrease the heart's need for blood and work with what you have. And sometimes what you have isn't enough, I get it, and I see patients who are symptomatic. But if we can balance those two, so if we can bring in the interventions and the support and the treatments that increase blood supply and worked on decreasing the heart's demand, well, that would be a lot more effective as a strategy, if you will. At least that's how my brain thinks as someone who thinks more integratively. So metabolic cardiology is not new. Dr. Steve Sinatra sort of coined the term, has written extensively about it. And it really comes down to the heart tissue and the mitochondria, if you want to get technical, and how effectively or efficiently the heart can produce energy. And so in nutrition or clinical nutrition, there's a growing body of evidence that's starting to show that very specific nutrients, what we call targeted nutrient therapy, is extremely effective at supporting metabolism, whether it's in the heart, whether it's in the brain, whether it's in other organs or systems in the body. And by supporting metabolism, we actually enhance or increase that organ or that tissue's resilience to some of the damage or stresses of having ischemia or having decreased supply. And so what I'm excited about as we move forward and we continue to look at different treatment options for patients is to look at these integrative models of care, these system-based integrative models of care that incorporate everything we know in conventional medicine in terms of how to support patients and get them treated, but also bring in some of the elements that we're learning more and more in nutrition, lifestyle, diet, mind-body techniques like biofeedback and yoga and meditation. All of these things can come together and really support patients in both having decreased symptoms but also increased resilience and much better outcomes over the long term. So that's all great in theory, so now we need to actually do the work. And that's really, I think, what this LEOCADIA is about. Doing the work is hard work. Doing the work means increasing dialogue between providers, increasing resources so we can fund research, creating new models of care that might not have been created before. So we're moving from standardized research to looking at more system-based clinical outcome studies, which are more complex. They're more in line with what we can measure in integrative medicine, where treatments can be a lot more complex. So it's a lot of work, and I won't bore you with those details, but that work needs to get done. When Sue has, over the year, as we've talked about this organization, the mission, the vision, the future, and what we're going to do with this organization, this is really where I see it going. It's doing it right now. We're having a dialogue. Well, maybe a monologue at this point, but but it's creating dialogue. It's creating opportunity for us to get together, talk about the condition. It's hopefully going to create opportunities for us to raise funds, to draw in different providers, different researchers who are interested in looking at more complex questions, more complex answers, and hopefully continue to raise the bar on what we know and how we approach and treat this condition. So that's what I'm excited for. I think I'm here to stay with Sue for the long run. We'll see. I look forward to continuing to come every year and hopefully share new information with you. I want to sort of echo what everyone who's been up here has said, is we couldn't have done this without your support. So I'm grateful for your support, and I'm grateful for Sue for inviting me to this. And I'm looking forward to what we all do together over the next few months. So, thank you.